outside. So we'll have outreach workers, people that go outside and try to get people to come into the resource center. And maybe even if they're struggling where they don't want to come in to live here temporarily or stay overnight, we'll say come during the daytime, store your stuff here, take a shower, have a meal, go see the doctor and the nurse, and start to build a relationship, baby steps, and then to get them to maybe, it's not so bad, I should stay here, and then we can get them not just a shelter bed, but get them into housing. And we've seen it happen across the street, but this is going to give us that ability to really work well with people.
Right.
The big difference to this facility to that across the street at Father Mills is this is going to be 24/7. So people aren't going to be kicked out in the morning, kind of roam the community. Maybe if they don't have any destination, they can stay here. And we'll have a lot of programming during the daytime and stuff. So we'll do 3 meals a day. So our breakfast will be for people that are guests of the shelter in a sense of staying here at the shelter. But our 32 units of housing, if any of the people there would like to come over, they'll have kitchenettes, and I'll show you a unit. They can come over here and eat too, so that's fine. So this will be serving 3 meals a day. Our breakfast and dinners will be for people that live here, but we will provide a community lunch. So anybody in the community maybe that can't afford a hot meal, or we have a lot of people that are kind of struggling every month just to pay the bills. They could come here and have a meal if it works for their schedule and everything. Because it's a community center. That's the change that we want to be able to make here. Come here if you just want to, you need help with food insecurity, you need help with, maybe you're facing homelessness, you need help with a social worker, just some medical issues, whatever it might be. Because ideally, we'd love to start learning about what you're struggling with before you end up having to come here and say, I have no place tonight, even though we'll provide that emergency bed no matter what.
Right.
The nice thing about this room, too, is we're creating, this wall here that we able to open and close so we can have multi-purpose meetings and use here. You could have a small group that are just lounging in here and relaxing, and then you could have an AA meeting, an NA meeting. You could have the VA, the Veterans Affairs here. We'll use this for career fair space. We have a lot of people, 15, 20, 25, depending on the market. 25% of our guests are working. A lot of them are trying to get back to work. So we try to bring in companies to come in. We can use this space as a little job fair area and stuff like that. So multi-purpose room, which is exciting. We have a lot of, especially women that come here that are kind of maybe coming from a bad relationship, fleeing a domestic violence or trauma, mental health issues. And to have a calming place, just as tough as it is to be homeless and as beautiful this building is, it's still hard. You gotta stand in line and get things and this and that to kind of have a nice calming space here for our people. And then people aren't, kind of out in front of the building and the neighbors. Everybody gets to see you here. You can kind of be by yourself or
Privacy is
nice privacy. Like we talked to a lot of other people around the country about what works, what doesn't work. Of course, we've been doing this for over 30 years, sad to say, so we had a lot of thoughts. But I think some of the stuff that you're seeing maybe, it's like, wow, thoughtful was where to invest, and a lot of times you wouldn't invest in. And I think we took a lot of those things of what the guests, people that were experiencing homelessness were telling us. Now it's gone up, of course, than what it is because of inflation, delayed product, behind schedule, all those things. But coming in right around close to $25 million. So the public funding, like the governor at the time, Governor Baker Polito, and the state government was very supportive of this new model. Federal government was very supportive. City of Quincy was great also. But we had to raise $10 million privately to private companies, foundations, people. And so you'll see certain parts of the building that have namings, and that's because we had a lot of people come in and help us build it and stuff, which is nice. The space here is lockers, so everybody will have their own locker at their place. The other big change will be for this new facility is people will be allowed to let their belongings stay here during the daytime. So a lot of times in shelters, they ask you to leave in the morning, or you might have an appointment or whatever. Might be going for a job interview, might be going to a workforce training, might be going to school. We have a lot of young adults in this building, sad to say. But people will be allowed, so when they're going, wherever they're going, they're not carrying all their bags.
Right.
It helps them because they always say, geez, people, they know I'm homeless. Oh, that's somebody from
Right
Father
with the
Bill's.
backpack, right.
But then it helps them when they're engaging in the community and all that. So that'll be really that. You know, when COVID first hit us in the spring, was 2020, right? Within probably 3 weeks of kind of the outbreak really hit, you know, March, April, we were at 30% of our population was infected with COVID positive. So, because everybody was on top of each other, right? Sleeping next to each other, and you know, so when the South Shore Y had been closed because of COVID. So, you know, thankfully, the city of Quincy, the mayor, and we all communicated. I'm like, I need to move, like, we got to socially distance 6 feet. That's what we got to do. We're going to have people dying at the shelter or continuing to get sick. So we were able to go into the Y and use the field house to move half the population out of Father Bill's. And as soon as we did that, within like a couple of weeks, the infection rate went below 2%. There's so many people that are homeless, like any of us, that might be shy, and especially people that have mental health issues, that they may not come into the shelter because of a simple thing like this. So when we talked and did focus groups with people, the privacy issues of a shower in a congregate shelter was huge. And so this is one of those areas where, like, what we thought about and taking the opinion. If you come and you bring your things and you don't, and then if you come back, you may not get the same bed. But if you're working with us, if you're like, yeah, I'm going to be here for a couple of days, you work with the case manager, we're like, yep, same bed, same thing, here or there. You know, we also have a lot of people that can't climb to the bunk bed. So we also, a lot of this is with our healthcare team downstairs, being able to say, this person needs to have a lower bunk. This person can have an upper bunk. All of those, just gives us that kind of flexibility with that too.
Do you have families?
Okay, so we right now are sheltering 160 families a night throughout the South Shore. They're not going to be in this building. This will just be for individuals 18 and over. Yeah. Now, because it's a resource center, if families come to our door, we will serve them here. We'll help them. They can see the doctor, and then we'll get them to the appropriate family shelter that we operate or somebody else does, but they won't live here. We keep the kids and the families completely separate from the adults. It's probably one of the lowest points of their life. And you know, we balance this up. We want a facility where people don't get comfortable and want to stay here. And I'm like, you know what? Once you see a dorm like that, and then you go see a housing unit, you know, like, okay, I want people to know, like, when they come in here, like Father Bill always told me about, like, we want to give people dignity. We want to give their dignity back. We don't want to judge them. We want to make sure that they know that we love them as a community. And so in a facility like this, when you think of like just the simple things that we're adding here of a new facility, I think it's going to show people in a tough moment, if a woman comes and walks in this door, and as hard as it might be, it's like, all right, this is pretty good. You know, it could be a lot worse. Yes, it's still a shelter. We only want you to stay here for a few weeks. You know, heavens if it's a few months, but it probably could be for a lot of people. But people will want to move on. Now, we've got a lot more people that are coming into our shelter, so we can't get enough housing for people. But you're right, when there's openings, when there's opportunities, and we're continuing to build more housing. 32 units here, we're building something in Stoughton, we're building something in Brockton, so we want to keep building housing. We have houses in Weymouth and Hingham and Hull. We need more housing for single people or individuals and families that are more affordable for people. You know, so a lot of the people here work more of those frontline retail, you know, restaurant type jobs. You know, even being a bank teller right now is tough to make the rents. But we want this to be quick. So one of the differences in this building would be is like above the 100% of the people that come into this building, about 60 to 78% of the people really just need a little bit of help and then they'll move on. What we want to do here for those people is right now when they come to Father Bill's, and let's say we have a lot of laborers that come to us, people that work in the trades or roofers, and say in the roofing business, and the winter comes, you get laid off, but then you're going to have work again when the weather gets nice. I've had laborers that literally like are right on that edge, right? When they're getting work, they can go out and find their place, but then when they get laid off because they didn't make enough, they're going to need this place. What we're going to look at is if you come in and you're work ready and you got a job, and we'll have employment specialists here and all of that. and then if you're working and say at Dunkin' Donuts right now, you're gonna stay here for 3 or 4 months just saving up for first, last, and security. You're gonna need
Right.
$2,000 or $3,000, right?
I know.
And I'm like, so what the difference here is what we're raising money for, a lot of our donors are supporting us and the public government, is we're gonna say, oh, you have a job at Dunkin' Donuts, we'll confirm that. Oh, let's help you find a unit. And if you can afford it, but all that's holding you back is first class and security, let's pay for it and get you out of here.
Yeah.
We want to speed that up. So it will give it to the landlord. We're not going to give it to the person. It's all going to be like, we know it's going to the right thing. But it's one of those things where we could really turn the the census here down because we can reduce the length of stay.
Right.
And we want each bed per, we serve about 900 to 1,000 unduplicated people at Father Bill's. We've been serving the same kind of amount, maybe, sometimes depending on the housing market, employment, cuts in the community, opiate crisis, different things will change. It might go up to 1,300 a year, it might go down to 900, but it stays in that kind of range. So if we know, we know on average by a couple of hundred what we're going to serve, anywhere from 900 maybe to 1,200, 900 to 1,200 people. If we could recycle each bed by like 7 or 8 times, move people on quickly, we could
Right.
really start to reduce
Right.
the shelter. Yeah. It's called a medical respite. There are so many people that are experiencing homelessness that we see that where, like, if you or I had to go get an operation at the hospital, they would try to send us home pretty quickly, and we'd get visiting nurses. So maybe we're not able to work yet. We would go home visiting nurses, but you need bed rest, you need care, and those type of things. We have people that are, going through chemo, and then they sit. So what happens now is they sit in the hospital inpatient, even though they don't need to be there because they don't have a daytime place to be. They don't have a home, right? So it costs the hospital a lot to keep that person, in the inpatient when they don't need to be there. So this is a win-win where we're going to create here a medical respite where if we have a shared customer with the hospitals, then they will pay us a much reduced rate to provide the day-to-day support. We'll bring in the visiting nurses. We'll have the healthcare center downstairs to connect, coordinate. It'll be a very much of an acute response in stuff. You've got to be, but it will give them a separate bathroom, stay here for a couple of days. Or a couple of weeks, and then they can move into the general population in the dorms. So it's very cost savings, but it's also very good for the person to recover in an environment like this. Instead of a lot of people, as I've seen the respites, what the hospital's dealing with, sometimes the person's in the hallway or and things like that.
I didn't realize
and the
that
the VA has for veterans. We serve a lot of veterans here. The VA is so excited about this model that they already purchased 4 beds for veterans in the medical respite, for homeless veterans. Yeah. We did a pilot in Brockton with Signature Healthcare, proved so much that we're kind of like, we're doing it anyways. And at the end of the day, even if the local hospitals don't engage to a level where I hope they'll see the value of it, and I hope they recognize it, because we have so many shared customers that are people who are in the emergency rooms boarding for behavioral health or medical issues, that I think that everybody will be wanting these beds. We'll have the people here ourselves with Man-It. We'll be able to fill this. Yeah. Over 50% of the people that are here have mental health issues.
Right.
We have a great partnership with the Department of Mental Health. We have housing that's just for people with mental health issues. A lot of people next door here will have mental health issues that we'll be able to house. So we'll have other agencies that are in here that support people, and will broker their services and get them help. Man-It will provide a lot of behavioral health support with us too. Yep. Volunteers of America is going to be in the building. Have you ever heard of Volunteers of America? They're like a national. They're going to be in the building, providing a lot of clinical support. One of the things Father Bill's is we don't want to. We very much want to partner and collaborate with people. So we're like, we have a new model, guys. Come here and provide and get connected to the population that's eligible to get your services. Father Bill's in Mainspring wants to, doesn't want to be, we can't afford to, and we shouldn't be everything to everybody, because we're not the experts in everything. We're good at what this is, shelter and housing, really, and making sure everybody has a safe place to stay. we want to be a broker of service to people. Say, hey, we've got a great partner over here if you need this. We got a great partner over here if you need that.
That's great.
Really, the piece of this here is that less than 10% of the people that we house have cars. So we'll have a bike rack room. We'll have a bike racks. And we hope people get cars, but they'll probably move on from us before they can do that and stuff. So basically, these are like a little over 300 square feet. If you think about a lot of efficiencies and things that they've been building. I mean, my dorm room, I had 3 people with me. This is the size of college, right? Yeah. So it gives everybody when you think about, okay, you're living next door, in a big room, nice, but wow, when you can get this is home. This is home, right?
And again, light and the trees and
you control your own air, your cooling. We'll also give everybody a small TV, so they start out.
And how long do you expect them to stay here?
So it's permanent housing,
Yep.
but usually I would say on average, couple of years, 3 or 4 years, just to get back on their feet. But we may have people that have severe mental health issues, let's say. They could be with us for 7 or 8, 10 years. That's okay, because to get into this building, we're not targeting the working person to be in this building, right? We're not targeting that 70% of the people that come in that can move on pretty quickly. Our housing we're targeting is that 20 to 30% of the people that really have maybe a physical disability, a medical issue, a behavioral health issue, a fixed income issue. And so here it's like the rent stays fixed, it's safe, and they've been maybe chronically homeless, so they get we have a lot of supports for the people here, and a lot of veterans and things too. So yeah, we hope people move on, but it's permanent with a lot of support. No, it's one of those where we kind of looked at it and said, what is our role going to be? We're not going to be this big housing developer. We need to advocate for more affordable housing for people that we see. But where's the group that, when I came to Father Mills in 1996, we had people that had been averaging over 8 years of homelessness. Now, a long stayer, somebody like that, a person that's been there a long time, is like 100 days. So we want to, and that's the people that have the majority of a lot of the issues that maybe really give them a lot of barriers to get housing. Right. So, and the great thing about this you're attacking the chronic homeless people that are ricocheting in and out of emergency rooms, maybe mental health hospitals, even detoxes and treatment programs, is when you give somebody their own key, and then they know they have the supports and stuff, you can start to see them starting to put things together. It's very hard to try to get back into the workforce when you're across the hall there and you're fighting for a bed every day and you're standing in the line to see the nurse and the doctor and whatever. When you have your own key, right, you can start to say, okay, at my own place, I can start to think about now going back to school, or maybe going and getting some counseling, or dealing with maybe a substance use issue, or whatever that might be. I always argue with the Department of Labor. I said, you can't, I want them to give us more money to help people get jobs. And I'm like, and they want to give us the money when the person is homeless. I'm like, they've got to be, that's fine, we'll help them when they're there. But even when they come here, I need your money, because this is when the person can really start thinking about getting up, going to work, getting what they need. It's hard to make it, to do those other things when you're just fighting for a bed. We've lost a lot of rest homes and nursing homes in the South Shore. This is a national issue also. We've seen a lot of people with fixed income.
Yeah, it never occurred to me.
So that's it. So that's an issue. You've got a lot. I'm thinking about even all the family-owned rest homes and nursing homes we used to see in our communities that have kind of gone away. The last couple that I've known about, I've said, oh, can we do something? And they're like, why are you closed? We just can't do it anymore. And it's a tough financial model to make it work, and it turns into luxury condos. So it's tough to compete in the market, right? So it's going to be a national crisis. It's not like just a Massachusetts thing.